Well, obviously, I was very gratified because, this study required several years. It was a lot of work for the investigators. The neurologists did a fantastic job, the study coordinators at multiple centers around the world, but most of all, the patients, obviously, because every time we do any type of clinical trial, the patients are um, trusting us and they're taking a leap of faith because they all understand that there's some unknown and uncertainty whenever there's a clinical trial. So even though there was some basis to believe that this would work based on some initial pilot studies, et cetera, um, this was very important to try to generate sufficient data to prove to the FDA that it was justifiable to allow people to receive this treatment in sort of general practice. And so, and again, with with all of the uncertainties in our world right now, the fact that this was FDA approved in the current environment in a reasonably short time period after the data had all been collected and submitted to the FDA. It's been a while since the study ended, but that's because it takes a lot of time in any clinical trial to complete all of the evaluations and then all the analyses and get all the paperwork in shape to submit to the FDA. But from the time it was actually submitted, it was a relatively short time frame until approval, so that's very gratifying. It should be gratifying to patients as they hear all of these questions that, fundamentally our regulatory bodies are still doing, their job. And that was nice. The idea of focused ultrasound in general has been gaining more and more traction because patients certainly um, like the idea of a less invasive approach to treatment. Having said that, focused ultrasound also is a permanent ablation of a small spot in the brain, and that can have permanent effects. And if the ablation affects any nearby structures, or even if it's on target, but the patient has some unexpected response to the ablation, those things can't be reversed, right? So there's pros and cons to everything we do. When I do deep brain stimulation that's invasive, there's a risk of bleeding, there's a risk of infection, but it is reversible and adjustable. Everything has its pros and cons in this field. I think what this does, and what's great about this for patients, is it continues to expand the opportunities that patients have across the spectrum of their disease. What this approval does is it expands the range of clinical options for patients across the spectrum of Parkinson's disease. To this point, focused ultrasound has primarily been approved for treatment only of tremor, either essential tremor, which is a different disease, or Parkinsonian tremor. So patients who had what's called tremor dominant Parkinson's, where their other symptoms were fairly minimal. And that has been effective for a lot of patients over the last 9 years. Um, However, we really haven't had a great option to treat patients who have symptoms beyond tremor. And if patients had a severe tremor, but they had other symptoms, freezing, stiffness, and other motor fluctuations where their medicines aren't working as reliably or as well as they should, off times where they're spending more time with their medicines not working. When those are significant problems for patients, if they don't have a tremor, then we really did not have a great focused ultrasound option for those patients if they wanted to consider this. And if they did have tremor, it created a real dilemma because we could use focused ultrasound to treat their tremor, but we knew that that particular target in the brain, that application in the thalamus, was unlikely to help their other symptoms. So we'd have to make a choice. Do we just treat their tremor, or do they get a different procedure like deep brain stimulation, et cetera?